So this is regarding chronic inflammation, so which also included osteomyelitis. So the learning outcome, which means which we expect you girls to do after this lecture, is you can able to define what is chronic inflammation, and you can list the causes of chronic inflammation, and you can also define a special type of chronic inflammation called granulomatous inflammation and causes of granulomatous inflammation, and you can able to explain the mechanism involved in granulomatous inflammation and also the pathogenesis of osteomyelitis. Especially I'm going to concentrate on mandibular osteomyelitis and its complication and interaction of various chemical mediators released in inflammation and its relationship with systemic effect. Okay, so these are the things we are going to see. So first of all, chronic inflammation means there is inflammation, there is some trigger in immune mechanism that is there for longer duration, prolonged duration. It may be from weeks to months to years. But it is very active inflammation. It is not like very aggressive, but they are active, subtle inflammation, and they produce tissue injury and healing process simultaneously. Okay, whereas in acute inflammation there will be tissue injury. After tissue injury you will get the healing process. So here the tissue injury and the healing process happens at the same time. Okay, now chronic inflammation, in acute inflammation we saw inflammatory cell is neutrophil. Here you will be seeing mononuclear cells, mononuclear cells, which is nothing but mainly of lymphocytes and macrophages, mainly of lymphocytes and macrophages, and sometimes plasma cells also involved. Plasma cells comes from the B lymphocytes, comes from the B lymphocytes. Plasma cells are the antibody producing cells. Plasma cells are the antibody producing cells. So in the blood we have, I explained in the last class also, we have cellular component and plasma component, right? In the cellular component we have three types of cells, right? RBC, WBC and platelets. So in the WBC you all know there are five types of WBC, right? What are they? Neutrophil, eosinophil, basophil, lymphocyte, monocyte. Actually this lymphocyte and monocyte are involved in chronic inflammation. This neutrophil, eosinophil, basophil are involved in acute inflammation, are mainly involved in acute inflammation. So they look like neutrophil, eosinophil, basophil look like they have lobed nucleus. They have lobed nucleus. You understand? Some may have two lobes, some may have three lobes. You understand? So they look like a polynucleus, right? Polymorphonuclear leukocytes. Leukocytes means, leuko means white, cytes means cell. Leukocytes means WBC. See, they are called as poly. Poly means multiple. Morpho. Morpho. Morpho means looking. Nuclear. Nucleus. Nuclear lymphocytes or leukocytes. Leukocytes. Leuko means white, cytes means cell. It's a WBC. So it is all polymorphonuclear appearing WBC. Polymorphonuclear appearing leukocytes. Okay. Now, if you see the lymphocytes and monocytes, if you see the lymphocytes and monocytes, they are mononuclear. They looks like a single nucleus. It looks like a mononuclear, looks like a single nucleus. So they are called mononuclear leukocytes or mononuclear cells or mononuclear lymphocytes. Understand? So these cells, lymphocytes and monocytes, are involved in chronic inflammation. Okay. Now, if you take the lymphocytes alone, there are two types of lymphocytes. One is T lymphocyte, B lymphocyte. The B lymphocyte, when it is stimulated by the antigen, or it can be stimulated by the T lymphocyte. So whatever the way, if it is stimulated, it can become like a egg shaped cell. It can become like a egg shaped cell. It is called plasma cell. It is called plasma cell. So it is called plasma cell. They produce antibody. They produce antibodies. Understand? So what are the cells involved in chronic inflammation? Mononuclear cells, which includes lymphocytes and plasma cells and macrophages. This macrophages, most commonly it derived from the monocytes. It's most commonly derived from the monocytes. So now you understand, in chronic inflammation the cells involved are lymphocytes and monocytes. So lymphocytes are two types: T lymphocyte, B lymphocyte, and from the B lymphocyte we get the plasma cell. We get the plasma cell. Now macrophage we get from the monocytes. We get from the monocytes. Understand? So these are the cells involved in chronic inflammation. These are the cells involved in chronic inflammation. So now I told three things happens, right? One is inflammation, one is active inflammation, tissue injury, healing. This all happens at the same time. So next is tissue destruction. The tissue destruction is due to the products of the inflammatory cells. The inflammatory cells secrete some products that will destroy the tissue, that will destroy the tissue cells. Okay, so now you know there is inflammatory cells and there is tissue destruction. So during the tissue destruction, and they also stimulate the repair process. They also stimulate the repair process. So that's why there will be fibrosis as a outcome of chronic inflammation. There is fibrosis as a outcome of chronic inflammation, whereas in acute inflammation there will be pus formation. There will be pus formation. Whereas in chronic inflammation, the end stage of chronic inflammation is complete fibrosis. Complete fibrosis. So what are the causes of chronic inflammation? So any infection is persist for longer period. Any infection which persists for longer period, and that is leads to chronic inflammation. Okay, for example, our immune system has a difficulty in removing the infection. Okay, you all know infection. So if any bacteria or any virus comes, if our immune system has difficulty in removing them, or the bacteria or virus can hide, then it is become difficult to remove them, right? So that all will lead to chronic inflammation. That all will lead to chronic inflammation. So persistent infection. Okay, any infection is there for longer period, then the inflammation will be there for longer period. Example, mycobacterium tuberculosis and viral infection. Mycobacterium tuberculosis and viral infection. And there are some disease, our own body immune system, the person's own T cell will attack the person's own tissue. Have you heard of? Our own immune system, the person's own immune system will attack his own tissue. That is called autoimmune diseases. That is called autoimmune diseases. So the person will have the tissue in his body till he dies, right? He has his body till he dies. So his own immune system will attack his body. So that is called autoimmune diseases. Understand? So that is also is a cause for immune mediated diseases, is also a cause for chronic inflammation. Another thing is, for example, very young age female got breast cancer. Okay, now the breast cancer is coming in 24 age to 24 years and all. We see lot of cases 24, 25. If any young female gets breast cancer, and that too in Saudi, that is the topmost commonest cancer in women. Okay, so when a young female gets breast cancer, they remove the breast as a part of surgery. So, and they put silicone implants. They put silicone implants as a cosmetic surgery. So when they put silicone implant, that also create chronic inflammation. That also create chronic inflammation in long exposure. Any foreign substance is there for longer period, that also create chronic inflammation. These are the major causes of chronic inflammation. Okay, now let's go to the mechanisms involved in chronic inflammation. See, now this is consider, you all know alveoli. Okay, consider this is alveoli. The person got Mycobacterium tuberculosis. It's a bacteria. Okay, tuberculosis is a bacteria. Now we got a tuberculosis bacteria. It comes to the lung because the bacteria is in the air. So the person breathe that bacteria, it goes to the lung. If it goes to the lung, in the lung alveoli, we have macrophage. We have macrophage. The lung alveoli, we have macrophage, and that is called alveolar macrophage. That is called alveolar macrophage. So what happens is, once this macrophage comes, once this bacteria comes, this macrophage takes this bacteria. So now the macrophage take this bacteria inside. This is called phagocytosis, right? This is called phagocytosis, and this is called phagosome. This is called phagosome. This vesicle which is inside the bacteria is called phagosome. The macrophage also contains lysosome. They also contains lysosome. If you take any cell, they have lysosome. They have lysosome. The lysosome is full of enzymes. Lysosome is full of enzymes. What they do is, when any bacteria they phagocyte, they make a phagosome and they fuse the phagosome with the lysosome. They fuse the phagosome with the lysosome, so the enzymes kill the bacteria. The enzymes kill the bacteria. Now this macrophage cannot make these two go for fusion. Okay, because the bacteria is tuberculosis. The bacteria is tuberculosis. The tuberculosis bacteria will not allow them to fuse. Will not allow them to fuse. So the macrophage needs some help. The macrophage needs some help. So they secrete a substance called interleukin 12, IL-12. This IL-12 go and communicate with the T lymphocyte. With the T lymphocyte, then the T lymphocyte becomes activated. They become activated T lymphocyte. Then they release a substance called interferon gamma. Interferon gamma. Okay, this substance do 2-3 things. One is, they go to the macrophage, they make them to fuse. They make them to fuse. Okay, thus they kill the mycobacterium. Thus they kill the tuberculosis, mycobacterium tuberculosis. And they also go to the blood vessel. This is blood vessel. capillary, they go to the blood vessel. What is this? This is endothelial cells. These are all endothelial cells. In the blood we have monocytes, right? In the blood we have monocytes. This gives a signal to bring the monocyte. Once the monocyte come out of the blood vessel, it will become macrophage. It will become macrophage. It will become macrophage. Once again I am telling, if the bacteria enters the alveoli, it is taken by the macrophage. Then macrophage cannot fuse phagosome and the lysosome, because the mycobacterium has a power, strength, not allow them to fuse, not allow them to fuse, and then they need help. So they release IL-12, then IL-12 go to the T lymphocyte, and the T lymphocyte becomes activated. Then the activated T lymphocyte release interferon gamma. This interferon gamma go and tell the macrophage, help the macrophage to fuse, and meanwhile they go and communicate with the blood vessel to release, to bring more macrophage. Macrophage comes from the monocyte. Macrophage comes from the monocyte. So now we got lot of macrophage. Understand? So now all the macrophage comes out and they take all the mycobacterium and they kill. Okay. So the center area become necrotic, and surrounded by T lymphocyte, okay. So and the macrophage, you all understand? If you say no, then I don't know how to teach. Okay. So this whole surrounding is called granuloma. This whole structure is called granuloma. So this inflammation is called granulomatous inflammation. This inflammation is called granulomatous inflammation. So let me draw once again. So I hope the girl who said no, she will understand. Who said no, please concentrate. Okay, so there is a bacteria called Mycobacterium tuberculosis. This is a bacteria name. Okay, this is called Mycobacterium tuberculosis. This bacteria is present in the air. You all know air. Okay, it present in the air. So now the person is breathing, right? So this bacteria can enter into the lung. In the lung we have alveoli. And the bacteria enters the alveoli. In the alveoli we have macrophage. What is this? This is the alveoli we have macrophage. This macrophage normally helps to remove the bacteria. Dust, anything comes to the lung. Now we have bacteria entering which bacteria? The bacteria name is Mycobacterium tuberculosis. Now this bacteria is entering the alveoli. Now it enters the alveoli. Now we have a macrophage there. What the macrophage will do? They do phagocytosis. You are all health science student, okay? Even though you are not MBBS fellows, but you are still in the health science. You should tell the name, medical terminologies. What they do? They do phagocytosis. They do phagocytosis. So what is phagocytosis? See, this is a macrophage, and the macrophage sees any substance, then this macrophage will engulf like this, and they take the bacteria inside. This is called phagocytosis. This is called phagocytosis. So this bacteria which is taken inside a bag, that is called phagosome. That is called, the bag name is called phagosome. Understand? This phagosome has to fuse with another bag, that is called lysosome. That is called lysosome, because this lysosome has powerful enzymes, which can destroy the bacteria, Now this is a Mycobacterium tuberculosis. What is the bacteria? This is Mycobacterium tuberculosis. This Mycobacterium tuberculosis will not allow phagosome to fuse with the lysosome. You all understand up to this? It will not allow phagosome to fuse with the lysosome, right? Which means this macrophage needs some help, right? So immediately they sense that mycobacterium is not allowing them to fuse, so they release a chemical substance that is called IL-12. This IL-12 go and interact with a lymphocyte called T lymphocyte. There are different types of T lymphocyte. Okay, CD4, CD8, like that. Here it is CD4. Here it is CD4. It is a CD4 T lymphocyte. It is a CD4 T lymphocyte. Somebody is not understanding. Actually, I will be repeating at least 4 times. Okay, at any one of the time you will understand. Okay, don't get upset. So it is called CD4 lymphocyte, CD4 T lymphocyte. Understand? Now this CD4 T lymphocyte see the IL-12. When they see the IL-12, they understand macrophage need help. Macrophage need help. So they release a substance called, another chemical substance. See, they interact. The cells interact through chemical substances. The cells interact through chemical substances. They release a most very important chemical substance that is called interferon gamma. Interferon gamma. Lena, actually I know only 10-15 girls are interested in studying. Okay, I know this. When I joined in Ibn Sina, in 1 month of time I came to know this. Okay, it is my 4th year. So don't worry about them, because I become very patient. Now my skin is like a buffalo skin, so patient. Okay, don't worry. For the 10-15 girls who I am teaching, Allah knows it. In the day of Yamul Qiyamah, all the people will answer for this. Now phagosome. Now coming to the interferon gamma. This interferon gamma is so powerful, so that now we are producing artificially. Understand? It is very important. Now it's coming as a drug, interferon gamma. This interferon gamma, what they does is, they do 3 things actually. I'm telling you at least 2 things you should remember for your level. One is, they go to the macrophage, make this fusion to happen. So this fusion happens, lysosomal enzymes kills this bacteria, kills this mycobacterium tuberculosis, Okay, now one bacteria is killed, but there are lot of bacteria, right? There are lot of bacteria, which means we need more macrophage. So this interferon gamma goes to the blood vessel. This is blood vessel. In the blood vessel we have monocytes. So they recruit the monocyte, and the monocyte once jumps out of the blood vessel, it becomes macrophage. Once they jump out of the blood vessel, it becomes macrophage. Now all the macrophage They go to the what? To the site of infection. To the site of infection. You understand? They all surround the mycobacterium and they take the mycobacterium. They take the mycobacterium. You understand? So now crowding of macrophage coming, right? Too much of macrophage comes. So this macrophage all fuse. They all fuse and they won't form a very big giant cell. Very big giant cell, that is multinucleated giant cell. You understand why it is happening? Once again I'm telling. Now you all know this mycobacterium tuberculosis is present in the air. Okay, the person breathing. Okay, for example, if you go to India, if you go to Pakistan, if you go to Kashmir, okay, so this mycobacterium is very common there. Especially in the tropical countries, mycobacterium is very common. If you go to that country, okay, it is normally present in the air. Why we are not getting infected? Alhamdulillah, we all have good amount of macrophage, good amount of T lymphocytes. Okay, because we have good amount of immune system that is killing the mycobacterium. If our immune system goes down, the mycobacterium comes up. Understand? So now the person taking the mycobacterium inside, it goes to the lung. In the lung we have macrophage. The macrophage takes the mycobacterium. Okay, one second I draw. Now you people try to engage. Now this is the mycobacterium, right? It is mycobacterium prone area. Prone means mycobacterium is more in that area, like India. Okay, so mycobacterium prone area. The bacteria name is mycobacterium tuberculosis. Now the person breathes, right? The mycobacterium enters the alveoli. Now alveoli we have macrophage. Now this macrophage takes this and put it in a bag, right? This is nucleus. Put it in a bag. That bag is called phagosome. That bag is called phagosome. Phagosome. And there is lysosome, right? There is lysosome. Normally, if it is some other bacteria, they fuse. They fuse, right? But this mycobacterium is so clever, so they will not allow them to fuse. They will not allow them to fuse. Okay, now what happens? They need help, right? They immediately they release IL-12. This IL-12 goes to the CD4 T lymphocyte. CD4 T lymphocyte, and the T lymphocyte release interferon gamma. Interferon gamma. This interferon gamma go to the macrophage and they make them to fuse. When they fuse, the lysosomal enzymes kills the mycobacterium, as well as they destroy the cell. As well as they destroy the cell. You understand? So now we need lot of bacteria, we need lot of macrophage. So they go to the blood vessel. In the blood vessel we have monocyte, and the monocyte comes out. Monocyte comes out, and that becomes like a macrophage. Now we have lot of cells coming out. Lot of cells coming out, right? They all go to the bacteria. They all go to the bacteria. Now it is surrounded by the macrophage. It is surrounded by the macrophage. You all understand? This is surrounded by the macrophage. When more amount of macrophage is coming, they fuse and they form multinucleated giant cell. They form multinucleated giant cell. Okay, so during this process they kill the mycobacterium and the cell also die. The cell also die. Okay, when they take the mycobacterium, they immediately they release IL-12 and they get the T lymphocyte. They get the T lymphocyte. You understand? Now this area is surrounded by the killing of mycobacterium and the enzymes will also destroy the macrophage, and there is full of necrosis, right? Cell death means what? Necrosis. And this necrosis is surrounded by macrophage, that is called activated macrophage, that is called activated macrophage. And it is also surrounded by T lymphocyte, and because more macrophage crowding, they all fuse and they form multinucleated giant cell. So this Kullu structure is called granuloma. This Kullu structure is called granuloma. So if it is chronic inflammation, they form this structure. It is called granulomatous inflammation. It is called granulomatous inflammation. If it is a chronic inflammation, if there is no such structure, it is simple chronic inflammation. It is simple chronic inflammation. So in other words, so there is chronic inflammation. If there is granuloma, then it is granulomatous inflammation. There is chronic inflammation, no granuloma, then it is simple chronic inflammation. Understand? Okay, now there is a necrosis in the center, right? Center of the granuloma. This necrosis happening in the center of the granuloma. This necrosis looks like a cheese. Looks like a cheese. You all know cheese, right? Looks like a cheese, and that's why they call it is caseous necrosis. It is called caseous necrosis. Caseous means cheese like. So it is called caseous necrosis. So when you see a granuloma with caseous necrosis, it is called caseating granulomatous inflammation. It is called caseating granulomatous inflammation. If there is granulomatous inflammation without necrosis, it is called non-caseating. It is called non-caseating granulomatous inflammation. Understand? So caseating granulomatous inflammation is seen in tuberculosis. Understand? So this is about the mechanism of chronic inflammation. Okay, let us explain in this picture. See, now you all know there is a macrophage gets activated, right? Once it gets activated, they release IL-12. They release IL-12. That will activate that stimulate the T lymphocyte. That will activate the T lymphocyte. The activated T lymphocyte release interferon gamma. Then again that will go to the macrophage. So this is the cycle. So this is called chronic inflammation. So the cell involved in chronic inflammation are lymphocyte and macrophage. The mediators, chemical substance involved in chronic inflammation are interferon gamma and IL-12. So now coming to the granulomatous inflammation. So granulomatous inflammation is again a chronic inflammation. It is a chronic inflammation, but it has aggregates. Aggregates means clumping, group. Aggregates of activated macrophage, which looks like a epithelial cell, so we call epithelioid. Oid means looking like. Oid means looking like. Understand? So the activated macrophage in microscope, it looks like a epithelium. So it is called epithelioid. Understand? So that's why they have a specific pattern, distinct pattern. That is the pattern which I draw. Okay, they have a central necrosis surrounded by the activated macrophage and T lymphocyte, and the macrophage fuse and form giant cell, multinucleated giant cell. So this whole structure is seen, then it is a granulomatous inflammation. The best example is tuberculosis. Tuberculosis is the prototype of granulomatous inflammation, and there are other disease produce granulomatous inflammation. One is leprosy, other one is syphilis. Syphilis is caused by a bacteria called Trypanosoma pallidum. It is sexually transmitted disease. It is sexually transmitted disease. Okay, they also produce caseating necrosis, caseation. And tuberculosis is produced by the Mycobacterium tuberculosis, and they produce caseating necrosis. And leprosy is produced by the Mycobacterium leprae, but they produce non-caseating granuloma. They produce non-caseating granuloma. So what's the time? Okay, just I will discuss about basic things about bone. Okay, next class I will talk about infection of bone. Okay, so osteomyelitis means, it is, osteo means bone, myel means bone marrow, itis means inflammation. Okay, it is actually literally it is called inflammation of the bone and bone marrow, but actually we don't mean that. We mean it is infection of the bone. We mean it is infection of the bone. So we mean osteomyelitis means infection of the bone. Now, and I told any infection will produce inflammation. Any infection will produce inflammation, and that inflammation will produce necrosis. Inflammation will produce necrosis. So this is the process seen in osteomyelitis. Please understand, if bone infection comes, that's why very important I am teaching more for you. It is very difficult to cure the bone infection. Understand? Because our antibacterial drugs cannot assess the site of infection. Understand? It is very difficult. I will tell you why it is difficult in the next class. So now let us talk about only basic things which you all know about bone, because I think in anatomy they would have discussed. Normally, long bone, we classify the long bone into two end, right? They have ends and they have shaft. They have shaft. Ends are called epiphysis. Ends are called epiphysis. Shaft is called diaphysis. In between the epiphysis and diaphysis, we have metaphysis. We have it will come. So in between the epiphysis and the diaphysis, we have metaphysis, which is contains growth plate. Okay, which contains growth plate. Okay, so these are all they would have discussed you in the anatomy. Just I'm just revising it. Okay, so now the outer layer of the bone is covered by a membrane called periosteum. By a membrane called periosteum, and inner layer is called endosteum. Inner layer is called endosteum. Okay, so some outer bone, see, outer bone is called cortex, inner bone, trabecular bone, is called medulla. It is called medulla. These are all basic structure of the bone. Okay, now there is blood supply to the bone. The blood supply is called nutrient artery. It is called nutrient artery. See, there is some variation in the blood supply of the bone if the baby is 0 to 2 years. Okay, so what happens is there is connection between epiphysis and metaphysis. See, if you take a bone, this is epiphysis, right? This is diaphysis. This is metaphysis. This is metaphysis. So now there is a metaphyseal blood vessel, right? If the baby is 0 to 2 years, there is some connection between metaphysis and epiphysis. There is some connection between metaphysis and epiphysis. So that connection is called transphyseal vessel. Transphyseal vessel. So this is epiphysis. This is metaphysis. So this connection is called transphyseal vessel. Very important. It is called transphyseal. It is called transphyseal vessel. Very important. Okay, So inshallah I'll discuss about infection in the next class. Up to this, please study and come. Understand? So it will be easy for you in the next session. Okay, so next session I'll be taking continuous 2 hours with 5 minutes break. Okay.